First, remove the blood pressure monitor from its box. Turn the device over and open the battery compartment as shown. Insert the supplied AA batteries into the device, carefully taking note to ensure the batteries are inserted the correct way round. If your blood pressure monitor won't turn on, double-check the direction the batteries are inserted and correct if necessary. When connecting the cuff to the blood pressure monitor, do not connect it to the power inlet in error. Connect the blue connector on the cuff pipe to the blue connector on the side of the blood pressure monitor. First, remove any loose or bulky items of clothing from your arm. For the best accuracy, perform the test on a bare arm or over thin clothing, like a t-shirt. The test should normally be performed on your left arm. Next, remove any items that could interfere with the blood flow in your wrist, like watches or bracelets. When ready to test, make sure you are not under the influence of alcohol or caffeine, as this will temporarily affect your blood pressure. Make sure you are relaxed, have not done any strenuous activity in the last 30 minutes, and breathing at your normal rate. Sit at a table with your arms supported, and the blood pressure cuff at heart height. Do not talk during the test. Take note of the directional arrows on the cuff. The down arrow should be pointing down your arm when the cuff is being worn. Position the cuff around 2 finger widths up from the inside of your elbow joint, making note to align the pipe with the main artery on the inside of your arm. When closing the cuff, it is important not to misalign the closing end. If it is offset, your readings may become inaccurate. Correct cuff tightness is essential. This is too loose and will cause high readings and discomfort when taking measurements. This is too tight and may cause slightly low readings. If you cannot insert 1 or 2 fingers between the cuff and your arm relatively easily, it needs to be loosened. This is the correct tightness. The cuff should be snug enough so that it cannot be easily rotated on the arm, but you can still insert 1 or 2 fingers between the cuff and your arm. Consistent positioning and tightness of the cuff will give you consistent results. Important, do not move or talk for the duration of the test. To start a test, press and hold the start-stop button until the screen turns on, then release it. The cuff will inflate slowly round your arm, then deflate slowly, after which your result will be displayed on screen. To allow comparable readings, you should test at the same time each day, as your blood pressure will vary during the day. Always follow the directions of your doctor or medical practitioner. If you have any questions or queries, please feel free to contact us.
With the blood pressure monitor turned off, press and hold the memory key until the user flashes. Press the memory key once more until the year is displayed. To change the year, press and hold the memory key until the desired year is shown. If you miss your year, just keep on the memory key and it will loop back from 2010 to 2035 and back again. Once the correct year is displayed on screen, press the memory key once to go to the next step to set the day. Follow the same process, pressing and holding to change the day until you get the right date. To change the month, press the memory key again, and then press and hold until you get to the right month. Once the right month is displayed, click once. This will then allow you to set the time. Following the same process, you can set the hour by pressing and holding the memory key. And then click once more to move across to the minutes. Press and hold the memory key until you get to the desired minute. Once you've set the correct minute, press the memory key once, and the time and date is set. Press once more, and now the correct date and time will be set on the device. To change the unit of measure with the device turned off, press and hold the memory key until the user icon in the top left-hand corner flashes. Once it flashes, press it once more, and this will enter the date and time setting. Keep on clicking the memory button until you go all the way through till it says SP off. Click it once more and you'll see that mmHg, all the other units of measure, will be flashing on the right hand side. Press and hold to change between different settings, between kilopascals and mmHg. In the UK, almost all measurements should be taken in mmHg. Once this setting is chosen, press the memory key once more, and now that is stored.